Hey everybody, Luke Gordon here, and today we are looking at the top 3 stretches you can do to improve your knee flexion after total knee replacement surgery. Knee flexion, again, is just your ability to get your knee to bend after surgery, and one of your very first goals after surgery is that you want to increase your range of motion, your flexibility, as quickly as possible. So in today's video, we're going to look at those top 3 ones, and I'll kind of walk you through each one, and then at the end I'll give you some advice in terms of how long to hold stretches and how to determine which ones are going to work best for you. So the first one is very simple. It's just sitting on a chair. It doesn't have to be a bench like this. This is just a good way to show you visually. But just sitting on a chair, like a dining room chair, it could be on your couch. And to get your knee to bend, what you're going to do is sitting back in the chair is you're just going to pull your leg back comfortably towards you. So if you can see me kind of here from the side, let's say you can't get really even close to 90 yet or 100, you're going to pull your foot back towards you as far as you feel comfortable. And then from there, you're just going to slide your bottom forward on the chair. So as you can see, as I'm sliding forward, my knee is bending. We're working on flexion. Let's say you hold that for about 20 or 30 seconds. Get a good, comfortable, kind of a moderate stretch, moderate intensity. And then when you're ready to go or ready to take the pressure off, then you're just going to slide your bottom back in the chair, just like that. So a very straightforward one to perform. The nice thing with this one is that you can do it pretty much anywhere. You can do it again in your dining room chair. You can be sitting on a soft, comfortable chair in your living room or the couch. And so it's really easy to do. Most stretches I'm going to give you, I'd recommend you hold for about 30 seconds to 60 seconds. And depending on how far you are along in your recovery, you might start to hold that even longer or go more intense. If you're right after surgery, you don't want to really force the issue too much because you're fighting a lot of swelling and a lot of pain and inflammation. But as it gets easier, you can start pushing that farther. So again, plant your foot, just pull it back comfortably as far as you feel like you can go comfortably, and then scoot your bottom forward, just kind of like using your hands. And then when you want to come back, just come back there. So that's one of my favorite ones. The second one I'm going to show you is standing up. And this is actually my favorite one overall. You see me okay there? So say you're standing up, and I want you to pretend that this bench now is my staircase, or it's a chair. A chair with arms will do, something that you can hold on to. I like a staircase. So for most folks, what I'm telling them to do is put your foot up on the second step of your stair, like that, hold on to the walls or the railings, and then again, let's say you're getting a little tight here, you're just pushing your body weight forward and bending the knee. Always make sure that you get your foot completely flat on the step. You don't really want to be like on your toe or anything like that. You just want to be foot flat. You've got a nice stable anchor point, and then you're just bending forward until you feel a nice stretch in the knee, holding that 30 to 60 seconds, and then you just back off. The reason I really like this one the best is because you have really good ultimate control of this stretch. It's easy to apply more pressure and hold, and it's easy to take it off. So it's really easy to adjust. And as you get farther and farther along in your rehab, you're getting farther and farther from that surgery date, you can start to push it really hard, especially if the swelling is clearing nicely. You can start to push that really hard and just sit on it and really work on flexing, bending the knee. So that's my second one, my second favorite one. And then my third one, this one's going to be kind of interesting. You're actually going to lay on the floor, and you're going to have a chair, or let's say this is like your ottoman or your couch in front of you, and you're going to lay on your back, and you're going to put your leg up here. See me okay there? Okay. So you're going to put your leg up on your ottoman just like that. And kind of like we did with the last 2 stretches, let's say you have both your legs up, you're just going to scooch your bottom towards the couch to get a good stretch. And then hold it comfortably again 30 to 60 seconds. And then when you want to ease off, you just scoot yourself back. The reason I like this one is because you could do this off and on for a period of time and just kind of stretch and relax. Your knee is elevated, which is really important early on with managing swelling. So you could be doing some ice on this at the same time. And you can also just be doing things like heel pumps. So just pump your heels to get the blood flowing. So not only can you stretch your knee for a prolonged period of time and deflection there, but then you can also work on getting the swelling to come back down into your leg. By the way, whenever I mention knee stretches, give me a second to get up here, I always like to mention that swelling is really going to be your biggest barrier with knee flexion. So we've got those 3 stretches I just showed you. Hopefully one of them works really well for you. You don't necessarily have to do all 3. You could just pick which one works best for you and do it throughout the day. But also keep in mind that you really want to manage your knee swelling. So I've got some more videos on how to do that. I'll pop up a link either here and or at the end of the video. But again, keep in mind that your knee swelling is ultimately what's limiting you from the flexion. So when you try to bend your knee, especially if you're in the first week or 2 after surgery and you feel all that pain and pressure in your knee when you're trying to bend it and you're trying to stretch through it, it's really, you're kind of like stretching into that swelling and the pain. So the more that you can get the swelling and the inflammation out of your knee, the better off you're going to be, and these stretches are going to be much easier and you're going to gain your range of motion much faster. So keep that in mind. Again, I've got some resources I'll link to the end of this video, so click on those if you would like to see those. So those are your top 3 stretches. Again, find one that works really well for you and just keep working on it throughout your rehab. And then I've got some more videos and information I'll do on the other direction, which is to extend your knee. So keep an eye out for that one too. So that's it for this one. Thanks for watching.